Hello and welcome to this lesson, myopia. So first let's understand what is myopia, or in another word, nearsightedness. This is a refractory error, and in the normal cases the parallel light rays have to be focused on the retina. In case of myopia, the parallel light rays are going to be focused in front of retina. And we have three main causes, three main types of myopia. We can have axial myopia, and this is due to the elongation of the eyeball. We have refractory myopia, which is due to excessive curvature of the cornea or lens or both. So as the result, we have increased in refractory power of the eye, and as the result, the light rays are going to be focused in front of retina. Also, we can have the combination of two problems. So as the result, we call it combination myopia. So in this case, we have both elongation, axial elongation, and also we have increased in refractory power. So here in this case, you can see a very good picture of the light rays. In the normal circumstances, the light rays have to be focused somewhere around here. But in case of myopia, we have focus of the light rays in front of retina. So we can have two reasons for that. If we have elongation of the eyeball axis, also we can have increased in curvature of the cornea or lens, and as the result we have increased in refractory power, so the light rays are going to be focused in front of retina. So what are the risk factors and epidemiology of myopia? First of all, this is a very common problem. About 1/3 of world population are myopic, and this problem is extremely common in East Asia, and more than 80% of people who are living in East Asia are myopic. This is a problem that starts in childhood. Usually the mean age of onset is somewhere between 6 to 12 years of age, and as the age progresses during the adolescence, we have progression of the myopia, and it is going to be stabilized during early adulthood around 20 to 25 years of age. And there are several risk factors. We have genetic is associated with myopia, and patients with a strong family history have higher chance of myopia. We have another risk factor. We have increased in near work, so patients who have prolonged reading or have prolonged use of screen use, they are in increased risk for myopia. Another risk factor is when patient is having limited time spent outdoor. Remember that the natural light causes inhibition of axial elongation, and as the result, patients who are staying indoors are having increased risk for myopia. Also, we have two collagen diseases like Marfan syndrome and Ehlers-Danlos syndrome. These are associated with myopia. Also, another risk factor is premature birth or retinopathy of prematurity. These two conditions are also associated with myopia. So what is the classification and what are the symptoms of myopia? For classification, we have three classes of myopia. We have simple myopia, we have high myopia, and also we have pathologic degenerative myopia. So in case of simple myopia, which is the most common type, the spherical equivalence of refractory error is less than 6 diopter, and this is usually the type that is presenting in the childhood and stabilizes during the adulthood. We have another type which is high myopia. In this case, a spherical equivalence of the refractory error is more than 6 diopter, and it is associated with several complications like retinal detachment and myopic macular degeneration. We have another classification, another part of this classification, which is called pathologic degenerative myopia, and this is a progressive elongation of the eyeball which leads to structural changes in the retina and sclera. So signs and symptoms are quite clear. Patient will have difficulty seeing distant objects, and usually patients squint in order to improve the focus point. Also, the patient may complain of headache and eye strain, and this is usually after prolonged visual tasks. On ophthalmoscopy, the patient will have normal anterior and posterior normal anterior and posterior segment, and this is usually happening in case of simple myopia. And in case of high myopia, fundoscopic examinations might change, and the patient will show myopic crescent, staphyloma, or retinal thinning. So what are the diagnostic tools that we can use for myopia? The first test that we are going to use is visual acuity test. This is the test that you are going to see, and in this case the patient will have problems seeing distant objects, and the problem is going to be corrected with the minus lenses. Recall that we have two lenses that can be used in ophthalmological settings. We have minus lenses and we have plus lenses. So minus lenses basically decrease the refractory power of the eye and causes the light rays to be focused on the retina instead of in front of retina. And note that in case of visual acuity test, usually near vision is preserved and does not have any problem. Also, we should test for refractory problem. So we have two tests for refractory problems. We have object refractory test, which is done via retinoscopy and autorefraction, and this is usually measures the refractory error objectively. We are seeing that if there is a refractory problem or no. Also, we can use subjective refractory test, and this is usually done via trial lenses. I am going to explain this in the hyperopia, so if you want to know what are the subjective and objective refractory tests, please see that video. Another test that we are going to do here is fundoscopy, and usually fundoscopy doesn't have any major rule in diagnosis of myopia. We are doing this in order to rule out complications like lattice degeneration, which is the thinning of the retina, or retinal detachment in patients who are suffering from high myopia. So what are the treatment options for myopia? First of all, we have spectacles. These are the primary treatments, and what we are going to use is minus lenses or concave lenses, and these lenses helps the eye to diverge the light rays in order to be focused on the retina. Another option that we have is contact lenses, and this is preferred when the patient is having active lifestyle, but patient has to be very careful for proper hygiene, because proper hygiene is required in order to avoid infection in the eye. Another option that we have is orthokeratology, and this is a rigid lens that is worn overnight, and it is temporarily reshaping the cornea. We have pharmacological therapy that is usually used for children, and in this case we are going to use atropine eye drops. We are going to use it in the low dose in order to slow down the progression of the elongation of the eyeball, and it is usually used in the children in order to slow down the progression. We have surgery options. We have LASIK surgery, and this is reshapes the cornea in order to correct the myopia. We have PRK surgery, which is standing for photorefractive keratectomy, and this is a surface ablation technique that is done in the patients who are not suitable for the LASIK surgery. And we have a SMILE surgery, which is a small incision lenticule extraction, and this is a minimally invasive surgery, and it is an option for correction of myopia. Of course, ophthalmologists should decide whether this surgery should be done or LASIK surgery. So what are the complications in case of myopia? First of all, we have probably the most dangerous complication is retinal detachment. Here in this picture, we can see a retinal detachment in the eye, and as you can see, the retina is detached from underlying basement membrane, and this is usually happening in high myopia, and it is due to elongation of the eye, and symptoms are sudden floater, flashes of the light, or patient may report that a curtain is coming in the eye field. Another complication is myopic macular degeneration, and this is usually due to the fact that we have the progressive thinning of the macula, and it can lead to central vision loss. Another complication of myopia is glaucoma, and myopia is actually strongly associated with increased risk of open angle glaucoma. Cataract is another complication that can happen in high myopia and predisposes the patients to early onset cataract. So if you see the patient who is suffering from early onset cataract, for example, in 30 years of age, probably the patient can have this problem secondary to myopia, especially in case of high myopia. So this is a classical question that you can see in the exam. A 10-year-old child which is presenting with difficulty seeing the blackboard at the school, but they have no problem reading a book or using the mobile, and when you do the visual acuity test, the visual acuity is going to be 20 out of 60 in the both eyes, and it is going to be improved with concave lenses to the perfect 20 out of 20. So the diagnosis here is myopia, and there are some red flags that you have to be very careful in the exam. For example, if the patient is reporting sudden onset of floaters or flashes in the eye in the myopic patient, this can be a red flag for retinal detachment. Also, in case of the patient who is suffering from high myopia with central vision loss, you are going to be suspecting the myopic macular degeneration. So these are the key points that you have to know for your board examination. Thank you for watching.